Heart health. Conventional wisdom has been that the best exercise to improve heart health and maintain a healthy cardiovascular system and thereby reducing the risk of stroke and heart attack or aerobic or so-called cardio workouts. Weightlifting has traditionally been considered an anaerobic exercise, and as such was not thought to be the best choice for heart health. However, that is no longer the thinking. Many medical professionals and personal trainers recognize the benefits weightlifting has on the heart and lungs, especially when combined with more traditional cardio workouts. Cardiologists actually. While up until recently cardiologists actually discouraged their patients from weight training and weightlifting, that view is changing. The American Heart Association published recent evidence that shows the benefits to the heart of working out with weights. The reversal of opinion is not only because physiologists now recognize that there is indeed an aerobic component to weightlifting exercises, but because of the overall improvement in condition and body changes that weightlifting and building muscle create. It has been found that increasing muscle mass and strength actually lowers resting metabolism and resting blood pressure. Heart, most important muscle. While the benefits of building muscle to the body's most important muscle, the heart, are becoming readily apparent for any healthy person, for the heart patient weightlifting and resistance training can be very important to preventing future heart attacks or other cardiac episodes. It is all about being in better condition and being stronger. It's not brain surgery, but it is basic heart science. If you have a weak heart, even simple tasks like walking upstairs, lifting groceries, even walking can put a strain on it. If you are stronger from building lean muscle mass, these tasks become that much simpler. Your heart doesn't have to work so hard. Studies have also shown that when people lifting weight were monitored for cardiac output, the heart pumped stronger and faster. Like any muscle, this builds stronger walls in the ventricle, the pumping part of the heart. Strong ventricles mean the heart can pump more efficiently, and effectively lowers resting heart rate, which can lower blood pressure, one of the main contributing factors to heart attack and stroke. Healthy heart. And of course, gaining a healthy heart is not the only benefit of weightlifting. Most people who have heart problems are also overweight or struggling with some of the other problems of obesity like diabetes. Weightlifting is a great way to lose weight and keep it off by raising your metabolism and making your body burn calories more efficiently. While minute-for-minute anaerobic exercises like weightlifting will not burn as much as an aerobic exercise like biking or jogging, in other words 15 minutes on a stationary bike initially burn far more calories than 15 minutes of weightlifting. However, it's been found that up to 2 hours after a 15-minute weightlifting workout, the body continues to burn calories as the muscles remain in an agitated state. The American Heart Association now recommends a 30-minute aerobic workout 6 times a week, and adding a weightlifting session of at least 15 minutes 3 times a week. Joint health. With our aging baby boomer population, joint pain and joint problems such as arthritis are rapidly becoming major health concerns. Knee, hip and other load-bearing joint surgeries are becoming increasingly more common. But did you know that a regimen of exercise that includes weightlifting and nutritional supplements like glucosamine has actually helped some people avoid surgery? Joint pains. First up, we must dispel the myth that working out with weights can cause joint pain. Now, I am not saying that no one has ever left a gym with a sore knee, or shoulder, or elbow, quite the contrary, people often do. But if that is caused by your weightlifting routine, you are probably doing something wrong. Chances are you are not warming up properly prior to weightlifting, lifting with poor technique, or too much weight, or are not allowing enough time for your joints to recuperate after sets. Here we are discussing the joint pain that can and does occur from everyday wear and tear, osteoarthritis or other conditions. Proper weight training has been found to actually improve joint health, return functionality and decrease this pain. Arthritis care and research. A recent study released in the October 2006 issue of Arthritis Care and Research followed 2 groups of patients with knee arthritis. One group was given a regular series of range of motion exercises, the other a regular routine of strength training exercises, that included weightlifting routines to strengthen the quadriceps and other leg muscles. All patients in the weightlifting group reported less pain than in the ROM group, and more importantly, X-rays of those in the strength training group verified that the progression of their arthritis had slowed. Regular exercise of the joints. Regular exercise of the joints replenishes joint lubricants and builds cartilage. Weightlifting increases the muscles around joints. Stronger muscles from weightlifting exercises offer more support to the joints. From the process of weightlifting, you become physically stronger. This means you can participate in more activities, which make your joints healthier. We already know how weight training builds muscle and how that can improve your overall health and help you lose weight. All orthopedic specialists agree a sure way to reduce joint pain and improve joint health is to lose weight, and ease some of the burden on those weight-bearing joints like the hip or knees, hips and lower extremities. Simple common weight training exercises have been found to be the best to reduce joint pain of the hips and lower extremities, such as squats and leg extensions. If you are not already weightlifting just as a matter of course to improve health, and are experiencing knee or hip pain, now is a great time to start. Many Americans have totally eliminated their need for anti-inflammatory drugs and other medications to manage the joint pain through weightlifting and strength training. And once you have eliminated your joint pain and start to realize all the other benefits from working out with weights, you can be well on your way on the road to better health and better fitness all around. Weightlifting and back injuries. Weightlifting is a great way to get in shape and stay in shape. However, like many physical activities, it is not without its set of risks. Probably the most common injury from weightlifting is back injury. But while back injuries are a potential risk from weightlifting, if they do occur, most often they are from poor technique or other errors made by the lifter that can be easily avoided. Back injuries. There are several possible back injuries that can occur during weightlifting. The most common are stress fractures that occur when flexing the muscles, tendons and ligaments of the back against resistance, such as one does during weightlifting. These types of injuries are most commonly caused by improper technique during squats, deadlifts and clean and jerks. Older people who may already be suffering from degenerative disc disease, or people who might already be recuperating from a back injury, are particularly susceptible to weightlifting-related back injuries. There are several ways to avoid back injuries while weightlifting. Know your limitations. Do not lift beyond your weight max based on your body condition. For many exercises it is easier, and for those with an injured or weakened back especially, safer to work out using weight machines over free weights. If you do choose to use free weights, make sure you work with a spotter. While the use of weight belts for most lifters generally is agreed to have little value, for those with an injured back they can be useful in preventing further injury. Check with your doctor or personal trainer if they think you should use a back belt. Do not attempt to do the weightlifting exercises that most often result in back injury, i.e., squats, deadlifts, clean and jerks, without proper training and/or supervision. Preventing back injuries. We've spoken a lot about preventing back injuries while weightlifting. What about returning to lifting after a back injury, one that may or may not have even been caused by lifting? First off, you can and will return, but do not expect to return exactly where you left off. You may be able to ease back into your exact routine. You may have to modify your routine to suit your current condition. Only your trainer or spine care professional will be able to accurately advise you. Most fitness pros agree, however, that after an injury, re-establishing that mind-muscle link that gets the body back into muscle-building mode is critically important, and the hardest aspect to the road back. It is best to start slow and ease your body back into bodybuilding gear when coming back from an injury, just as you would do from taking any significant break in your regular weightlifting routine. For more information about the overall health benefit, you can click the link below for more description.